We're in an epidemic of depression. Rates of depression are going up all the time. Our current model for dealing with it is not working. If you're taking antidepressants, essentially, it's taking the peaks and troughs off your experience a little bit. So it might make the lows a little bit less low, but it also might make the highs a little bit less high. And they often have really, really serious side effects. But I was first introduced to the therapeutic use of psychedelics when my friend suddenly, depression just bowled her over. She decided to go to Peru and have ayahuasca. She came back and she just was radiating her true self, her old self. Psychedelics are a tool to help people get down to the nitty-gritty of where they really need to go, and they can go there quite quickly. It's not just about psychedelics, it's not just about psilocybin or any of the others. It's about a new way of approaching our suffering. And rather than numbing and taking a tablet, it's about going towards the suffering. They can be the hardest things you've ever done in your life. You can feel so lonely and so scared and petrified. Sometimes people will be going through the most incredible battles within, and they're lying there completely still and you'd never know. Sometimes people are weeping and you think that maybe they're suffering and they're just feeling complete pleasure and joy. Most of the time, the experiences are just absolutely beautiful for people. And these are people that haven't had any pleasure in their lives for years and years. I can't believe I get to do it for my job. It's the most beautiful thing.
The world is changing. Inspiration is everywhere. It has never been so easy to connect, share, and bring people together. We're learning from others and finding the best in ourselves. Challenging our beliefs. Sharing our vulnerability. Overcoming our fears. Transforming ourselves so we can transform the world. How far can we go?
This is London Real. I am Brian Rose. My guest today is
Dr. Rosalind Watts believes that psychedelics can be used as medicine. That's right, all of those things that we've heard about that sound like dangerous drugs, DMT, LSD, ayahuasca, psilocybin, magic mushrooms, might be able to help us treat depression, addiction, anorexia, and more. And this is groundbreaking science from Imperial College London, the Center for Psychedelic Research, who has other colleagues of hers like Professor David Nutt and Dr. Rosalind Carhart-Harris, who we've had on the show before. And this is something that London Real is committed to and has been committed to for the past 8 years. Our latest movie, Reconnect, talks about my own ayahuasca ceremonies in Costa Rica and how it changed my life. This is a time for the rebirth of these psychedelic medicines that were demonized in the past, and I believe that they can help us take humanity to the next level and treat a lot of the things that we're using pharmaceutical drugs to attempt to mask the symptoms and not the root cause. And Rosalind is right at the cutting edge of this science. She actually sits with these patients during these 3-hour sessions and holds their hand and guides them through the processes of what it's like to go through a psychedelic experience. And we're big fans of the work that's being done at the Center for Psychedelic Research. We are donors to them here at London Real. And I know that this episode is going to blow your mind as to the possibilities that you could experience with using psychedelics to cure some very, very common and dangerous diseases. So sit back and enjoy this incredible conversation with Dr. Rosalind Watts. This is London Real. I am Brian Rose. My guest today is Dr. Rosalind Watts, the scientist, TED speaker, and clinical psychologist at the Center for Psychedelic Research at Imperial College London. Your groundbreaking research utilizes psychedelic medicines such as LSD, magic mushrooms, and DMT, many of which are still illegal, to treat debilitating diseases such as depression, addiction, and anorexia. You work alongside the pioneers, Dr. Rosalind Carhart-Harris and Professor David Nutt, both former guests here, and you have developed a therapeutic framework for the challenging integration process involved when using psychedelics. Roz, welcome to London Real.
Thank you.
So glad to have you here. I feel like, you're part of like the trifecta over at Imperial doing all these great things. And so thanks for being here. I appreciate it. Also, you've just watched our latest movie, Reconnect, last night. So that's kind of exciting because very few people have. And so I'd love to maybe talk about any themes that come up here.
Yes.
I've always assumed that people maybe watching this might not know much about psychedelics or even the work you're doing. And so I always think like if my grandma is in Arizona watching this, maybe we start off with kind of a bigger picture. If you ever meet someone on the streets and tell them like, why do you spend your life researching psychedelics? I know you used to work in the NHS. And why do you think they're important?
I guess I would probably say that having been a therapist for many years, that talking therapy doesn't always get deep enough, that it is often not effective enough for people, and that psychedelics are a tool to help people get down to the nitty-gritty of where they really need to go, and they can go there quite quickly. And people tend to understand that idea that, it's a catalyst for a deeper process that can make a therapy more effective.
Okay. And we're kind of used to that traditional therapy route where if someone has kind of a problem, they go and they speak to a therapist that can be years where they kind of try to walk them through what blockages and past traumas, and you were part of that business for a while.
Yes,
okay.
Yes. And I guess what happens is people come in and they will tell you their story, the story that they may have been telling for many, many years to themselves, to other people, and actually telling that story over and over again often doesn't help. It doesn't lead to any change. They might feel better temporarily that they have someone to listen to that, but they don't feel rid of that story. It stays.
Right.
And we see that in our study because we're comparing psilocybin with an antidepressant medication, and both groups get kind of talking therapy the whole way through. And we see the difference with the psilocybin group and the antidepressant group is that with the people with the antidepressant group, the story is still there. They might find that the depression is a little bit alleviated, that the symptoms aren't so severe, but the story is still there, and they still, at the last session, they'll be kind of speaking from the same place as they were at the beginning.
Right.
But with psilocybin, the story completely changes. It's like the story is on this level, it's like a cognitive story, and then they dive deep in, and then they transform. The story is like almost just like fragments, and the story is changed to a new story at the end of the process. So yeah, that's what they can do.
When did you first become aware that these might be tools that could be used and that you might want to be involved with?
Well, so actually when I went to university, magic mushrooms were legal. So I actually lived above a shop called Amsterdam of London, which was in Birmingham, because I was at university in Birmingham. And so yeah, we lived above this magic mushroom shop. So it was kind of, at that time, it was what people would use more than alcohol potentially, and some people would use that more. So that's when I was first introduced to it. Okay. But that wasn't really in a therapeutic setting. And also, I think, the mode of doing it ceremonially or therapeutically is so completely different, that in a way it's almost a completely different thing. But I was first introduced to the therapeutic use of psychedelics when my friend went to take ayahuasca. So when I was at university, she was at a different university and she left because she was suddenly, depression just bowled her over. Kind of felt like it kind of came out of nowhere, this really severe depression and anxiety. And she left university, moved home, was really, really struggling. So whereas the rest of our our group of friends were all off doing their thing in different places, she was in crisis. And she decided, after trying lots of different things and therapy and seeing psychiatrists, she decided to go to Peru and have ayahuasca, which at the time I was really, really concerned about and thought it was a really terrible idea. I didn't even know what it was. I couldn't pronounce it. I thought, my sister Googled it and said she might die. And I phoned my friend and said, please don't do this. It's a crazy idea. We can help you. We'll find another way, but don't do this.
That was the doctor and psychologist in you saying that. This is like 90s, maybe.
So that was, when would it have been? Yeah, a little bit later than that. It would have been like the year 2000, I think. Yeah, around that time.
All right.
And then, so yeah, I felt like it was dangerous.
And that reaction, do you still get that reaction from many
Other
doctors
people.
and psychologists? Yeah. Okay. And is that the official reaction of, say, like the NHS to this stuff? Or?
Unfortunately, at the moment, well, it's changing now, but it has been. So with my cohort of clinical psychologists, everyone I trained with, there was one person out of 42 that was a little bit interested in psychedelic work, but most of the others, when I've talked to them about it, have felt that maybe it overwhelms the defences too quickly if they're more psychoanalytically trained, or if people work in CBT, they might feel that they really believe in the model that they're using, and that it's also potentially quite threatening if something is coming along that's claiming to. I think part of it is that there's a threat if there's a whole industry around therapy and something's coming along saying, hey, that we're much more effective, that's threatening. Right. But there's also that idea of like the kind of quack saying, hey, I can fix the magic cure, I can fix you in a day. And that quite rightly they're a bit suspicious about that, because they know that trauma takes a long time to heal, and they're protective of their patients, their clients. They don't want them to be fooled into some kind of quackery. Right. And that's what we're really trying to show with our research, that this is real change, this is real, deep, scientifically backed transformational process.
Right.
Yeah.
Okay, so back to 2000, you said don't go. She went anyways.
She went anyway. She sold her car, I think, so that she could afford to go. And she came back, and she just, it's the eyes, the light in the eyes when someone is really suffering from depression, and you see the light kind of going out, and that there's that kind of disconnection and flatness, and they try and do something about it, but they just can't. And she came back, and it was like the light switch had been turned back on again, and she just was radiating her true self, her old self, the way she always has been. We grew up together as neighbours. She was just back to her old self, and she's still well now.
And so that opened your mind and said, maybe there's something here.
Yeah.
Okay. Even though your colleagues and cohorts from your class did not feel that way, you were like,
yes.
let me look into this more?
Yeah.
Okay.
So it took a long time, actually. So she had that experience first of all, but then I knew that had happened, and I was very interested, and I started looking into psychedelic research a little bit more, because it was just about starting up around that time. But then it took for me to be on maternity leave for me to actually have time to really do the research, because after my clinical training, I went straight into the NHS. That's how it works. They pay for you to train, you go into the NHS. And I loved working for the NHS. I loved all my colleagues, but the services were so poorly funded that we were working such long hours and so hard that you would see like 7 or 8 patients a day. So at the end of the day, I'd come home completely exhausted. I certainly wasn't going to open my laptop and do some extra research. I was just trying to kind of keep afloat, really.
Okay.
So it was only when I was on maternity leave and I suddenly had time. I was being paid my maternity leave, and I was at home with my daughter. Well, I was pregnant, and then I had my daughter, and I was doing lots of breastfeeding at night, and so lots of research when I was breastfeeding, and found it was a article by Michael Pollan called The Trip Treatment. Okay. It's a brilliant summary article, and I was just reading it, and it talked all about the Imperial research that was happening around the corner, and I emailed Robin, and he replied, and it all just flowed.
Wow, life changed there.
Yeah.
Okay, and so for people that are watching that either struggle with depression or know someone with depression, like you're kind of an expert in depression, and a lot of the work you do is on the depression study at Imperial. I mean, what are some things that maybe people don't understand about depression? Or I guess the typical thing, if you're in America, is you go to your doctor and you say you're depressed, and they write you a prescription. Yeah. So I don't know, what should we know about it?
So I think, firstly, there's the medical model understanding of depression, which is that it's a particular disorder and that you can be diagnosed by a doctor, GP, or a psychiatrist. And if you have certain of the symptoms, then you can, you fulfill the criteria for that diagnosis. That's the medical model. That's one way of understanding it. I think in that model, things that have happened to you in your life, traumatic experiences in your childhood, don't come into it. So the way I understand depression is that everybody that comes to see us, or everybody that contacts us because they want to be part of the study, when they talk about their life, when they feel safe enough to talk about their life, there are things that have happened to them in their childhood that have had lasting impacts on them. I mean, for most of us, for all of us really. But for some people, those events that have happened, those things that have happened have, for whatever reason, we're all wired differently. There's so many different factors at play in how something unfolds. Epigenetics, all of these different factors, but that for some people, those events seem to prevent them from moving forward in their life, and they seem to lead to the development of so if you think about your kind of mental chatter, your ego structure, your default mode network, it can also be called, it's the self-preservation system that we develop to keep us in line, keep us safe. So when things happen to us when we're young, things that feel scary, or just things that make us feel that we're not good enough, often we will develop a self-protection system that is really trying to course correct, trying to make us better, trying to make us more likable, or less likely to be abandoned, or less likely to be bullied. It's a huge factor. So we will develop this internal system which says, don't do this, you've done that wrong, don't do that. And it's this kind of critical inner voice that's trying to keep us in line. So what we develop as a safety mechanism to try and make us better and more safe and be able to be accepted by our peers and our families becomes a harsh prison, because that internal safety mechanism becomes the ruminating voice of never-ending critical, punitive directions. And that is what depression is for many people. It's being they can be in any setting, and they might look like they're okay because they've learned how to smile and be nice and laugh, and but inside what's going on is that the protective system is just attacking them constantly.
Wow. Until
they feel so hopeless and desperate because they feel like they're worth nothing, because they're constantly being attacked by that inner voice.
Wow. You know this well because you spent many years in the NHS talking to these people every day. So you know this very well.
Yeah, I think so. And I guess also, I mean, I'm very lucky that I've never suffered from depression. It's not something I've ever really understood personally, although there have been moments where I've had an insight of what it can feel like, but I've had people very close to me that have suffered it, and so I've been able to see through, what it's like for people when they're waking up all the way through the night, being racked by. I think people think depression is like a passive thing. It's like being sad, and often it's not. It's often this full of rage towards the self, and it's active, it's struggle, it's not just simple sadness. Simple sadness can be beautiful for people if like, for example, a psychedelic can help someone access that kind of more simple, pure sadness where they can just weep, and that can be a beautiful experience. But depression is more like a very complicated, very muddy, hopeless feeling of constant self-attack.
Yeah, it's weird when you say that word depression. Yeah, I always think of, someone's just dull and sad today. But it's not that, is it? It's this whole tumultuous thing that on the surface looks like they're disconnected.
Yeah.
But there's actually a really not nice time going on in their brain.
Yes, exactly.
Wow.
Exactly.
It's funny how you just described this whole defense mechanism. So I don't know if I've ever been in a depressive state, but I've had that inner critic my whole life. And maybe some of those behaviors come out in the movie. But I've been so critical of myself that I think that's why alcohol always appealed to me, because it just shut me up for a few hours a night where I could just have some peace.
Yeah.
Because otherwise I was taking shots at myself all day, every day. And it didn't matter that everyone else thought I was accomplished. For me, it was never good enough. And it's still never good enough, but I'm still finding some peace.
Yeah.
And so that was my coping mechanism, not by any means any better than a depressive state. But it's interesting how you talk about a lot of this is childhood trauma related. Do you think it all is?
Well,
also, I don't think trauma is understood very well.
Yeah.
People think, that means that you were sexually abused, or you were punched in the head, or there was a bomb went off in your city. But I mean, from what I understand on trauma, it's usually something that it's just unresolved and you're never able to talk about. And that incident could be something so simple. I've heard people, their dad said one thing to them when they were 10.
Yes.
And they never got to resolve it. They never got to talk to anyone about it. And that thing sat inside of them and caused them to go, be a CEO of a company or rob a bank or something crazy.
Absolutely.
So trauma is another word I think sometimes we don't define very well.
Definitely, because it's exactly that thing. So it could be one comment that somebody made once, but if that becomes part of your inner critical system, you could say that to yourself every day. And so it becomes a huge part of your inner furniture.
Right.
So yeah, it's completely different for each person what has caused them that kind of trauma. But I think many of us are essentially a little bit traumatized by our culture here, because we often, there's a kind of striving and loneliness and disconnection from nature and feeling of competition that's in the background. I remember being at school and just that kind of, in fact, my friend who got so depressed, in a way it was like a kind of delayed response to what happened in school, which is essentially, this feeling of we must, even though we went to a nice school, it was like, we've got to get good A-level results, otherwise we're going to be failures, we're not going to be able to have a happy life. And we worked really hard and got incredibly stressed, and just thinking about, so how often we were in like a soothed state. Like I often think it would be really interesting if we had some kind of device that could like tell us, well, we probably do have them now, actually looking at heart rate variability, but like how often we're in a soothed state where we feel like, I'm okay, I feel relaxed, and how often we're in a kind of not quite breathing properly, feeling like there's some threat, but we don't really know what it is, but that we're not quite safe.
The parasympathetic mode.
Exactly, yeah.
And you're saying it's probably like 95% to 5%.
Totally.
Right.
And so I think when we grow up with that, and our parents are also in that kind of like, got to do this, we're kind of in fight and flight a lot of the time. We don't have that kind of, so much of that expanse of just, here we are together, a community in our beautiful setting, and we're just going to dance, and we don't do so much of that. No. So we're all kind of a bit frayed, and I think that kind of burnout is a kind of it's part of our culture, I think.
And that's always been an issue probably in urban environments, because you're not connected. It's a high population density, a high comparison factor.
Yes.
But of course now with internet and mobile, it seems like you can get that anywhere you are.
Yeah.
Right? You could literally be in a town of about 50 people and now compare yourself to 50 million people.
Yeah.
And so it's no surprise that we're seeing a rise in depression, teenage suicide rates, and you see all of this coming.
Yeah.
And that's why you're thinking we need to talk about psychedelic medicines as a solution, but we also need to be thinking about these bigger issues here, because otherwise we're going to have an even bigger problem.
Absolutely, and also because otherwise we have this situation where we have this kind of discrete thing of psychedelic medicine or psychedelic therapy, but then people are coming back from those experiences back into the kind of toxic culture, toxic system really, and then it's very difficult to maintain the benefits, but also it doesn't change that system. We need to, in order for psychedelics to work more effectively and have more long-term benefits, because in our studies we have this amazing instantaneous effect on depression, but then the depression comes back. And I think that if we were in a different context, that it would be more possible for people to maintain that sense of wellness and connectedness, because they would be in communities that help them foster that, rather than going back to a community or going back to a living environment where the life just kind of drains out of you. You can just feel that kind of that connected feeling just kind of zapping by the day.
Yeah, and anyone who's had an experience and come back to an urban environment, I mean, it's very tricky.
Yeah.
My first ayahuasca experiences were in the old London Real Studios on the sofa. People are always shocked when I say that. But I mean, it was my apartment for a while, my flat. And I remember having to like walk outside after that. And that was really difficult to just go near traffic. Yeah. And even coming back from Costa Rica last year was very difficult. And that was on a very surface level. Yeah. So what's going on with all the psychological cues and the things we don't even notice? And now I'm thinking about my stepdaughter and her private school and how much stress she is as well. And again, I think there's a place for that, but we don't want it consuming these people. And we know it's going that way. Just to like finish up on the trauma and something that Gabor Mate talked a few times with me here, and I think it was in last year I did a movie called Iron Mind, and there was a guy, one of my mentors was John Joseph, and he was, sexually abused in foster care like repeatedly over years. And I had a divorce experience when I was 7, and I said, Gabor, my trauma's not as bad as John's. And he said, hold on a second, Brian, that's not true. He said, everybody experiences trauma in some way. And like you said, it could have been something your dad said to you at 10 that puts in a process, and someone else might have something that sounds like a traumatic experience, but they were able to process it.
Yes.
And so it's not fair to point out my trauma's harder or better or worse than yours. Everybody is dealing with something from their childhood, whether they grew up, I was about to say, whether they grew up in Buckingham Palace, that brings its own traumas.
Yeah.
Watch The Crown, right? So everybody has some things that happen to them that can be triggered, right?
Yeah. And things, people in their psychedelic experiences do often go back to early childhood, very, very early years, because we're so vulnerable in those times. We don't understand, we don't have the mechanisms for processing and understanding things. So when things happen, they feel kind of demonic and scary, I think. Like when things happen to a small child that's defenseless, and you don't have any way of knowing that if your mum's gone, that she's going to come back. You just feel completely like abandoned and scared and like you're going to die. Yeah. So I think just the process of birth and the process of being a baby can be really quite traumatic, and lots of people go back to those experiences in their psychedelic journeys. So, yeah.
Okay. All right. So the last few years you've been working on the depression study, which is using these psychedelic medicines to combat depression. And you do this, again, very scientifically. That's what I love about Imperial and Robin and David Nutt, is that you are by the book with the science because you want to prove this to the world that this is effective. So you're doing parallel treatments alongside antidepressants and your things, and really tracking what's happening with these people.
Yeah.
And so for people that are used to maybe getting an SSRI or an antidepressant, pill versus what the experiences is like on your study, can you break it down as far as like what happens, and maybe even talk about what's happening in the brain here that could allow such leaps in treatment?
Yes. Well, the first thing to say is that it's different for everybody. That's the first thing. But there is a broad, there's a kind of broad trajectory of what happens. So if you're taking antidepressants, essentially what we think is happening is that it's helping you, it's taking the peaks and troughs off your experience a little bit. So it might make the lows a little bit less low, but it also might make the highs a little bit less high. And people's accounts are that they feel a little bit numbed sometimes, that they can cope a bit better, and that they don't have the worst part of the real despair is taken away. So they're buffered. Okay. It's almost like there's some padding in their life and they feel a bit supported. And for some people, that's a really great thing, especially if they're going through a crisis. That buffering, that support can get them back on the track, can get them back doing the things they were doing before, and can be the beginning of their recovery, and they can get well again afterwards. It often doesn't happen that way. Often people stay on the antidepressants and stay on them for many years. Many of the people in our study have been on them for like decades. Often one won't work, so the doctor will try them on like 10 different types of antidepressants sometimes, and they often have really, really serious side effects.
Such as?
Intense agitation, kind of physical symptoms. Sometimes people have like a kind of dry mouth, or they might feel a bit kind of like, like kind of physical, shaky, sleep problems, sex drive, severely limited. Sometimes people feel nausea. And I guess the emotional blunting is the one that people really struggle with the most. So yeah, we've had people.
If it raises up your troughs, that's good. But if you also aren't getting any kind of highs or stimulation from the environment over time, that must just again disconnect you from everything.
Yes. Okay. And people feel that they don't feel their real selves because they can't. There's something about just the highs and lows of life. When they're real, and you're learning from them. They're teachers. Our pain is our teacher. We can learn about what's not working for us. But if everything's just buffered, people sometimes describe they're kind of like they feel a bit better, but they're just kind of like bumping along through life, and they're not. It does feel less meaningful. And we've had people in our study a few people have had to come off the antidepressants because the side effects have been so bad and they felt so awful that they just haven't been able to stay. But then I guess for me, the thing that I'm most concerned about with antidepressants is that They are supposed to be a kind of temporary thing to get you back on track rather than a long lifetime treatment, because that's the opposite of a treatment. A treatment is supposed to make something better, but if you have to keep taking it forever, then it's just like a crutch. It's not actually healing the problem. It's not working at the root cause. People often just, like one of the participants of our first study said that antidepressants are like taking a painkiller for a toothache. It numbs the pain, but the infection is still there, whereas he describes psychedelics as like a kind of antibiotic that actually stop the infection at the root. So people describe this feeling of it's not doing anything for the root cause, it's just helping the symptom, helping the pain. It's numbing me. But yeah, so it's a kind of temporary numbing thing rather than a deep treatment. So it's not supposed to be for life, but people often stay on them because when they try to come off them, the withdrawal can be absolutely horrific. And I was amazed in the first study. I had no idea, but some of the people with their withdrawal processes, it was unbearable to watch. Wetting the bed, electric shocks going off in the brain. It can be really, really tough. And it can be supported with the healthcare professionals can really support people through that. So anyone going through that, I'd urge people to get psychological support and really, stay in contact with their GP and really ask for the help they need, because it requires a lot of courage sometimes. Not always, some people find it okay. But I was surprised, and so I think for many people, because the withdrawal is so hard, they stay on them.
Okay. And it's an amazing business model.
It's an amazing business model.
Unlike the psychedelic business model, which maybe
Yes.
we'll touch on at the end,
Yes,
which is kind
yes.
of a few doses
Yeah.
of sometimes a plant that
Yeah.
is not patented.
Yes.
And whether they're big bad pharma companies or not, I mean, if whether they're bad or not, we don't have to debate. But if someone's going to be taking something for 20 years, then probably people are going to be interested in prescribing them that,
Yeah.
whether it's intentional or not, or
Yeah.
complicit or not. And I even know doctors in the States. I mean, writing a prescription is an easy thing to do, right?
Yeah, and I think it's often because our mental health services in the UK are completely overrun in the NHS. And so psychiatrists, all the psychiatrists I know are wonderful people that went into that profession to help and to heal. And they have so many people to see. They don't have time to do therapy, and many of them aren't trained to do therapy anyway. All they can do is write prescriptions. And GPs are they're so overwhelmed, with how many people they need to see, the suffering that they see, and I can relate to that. I can remember what it was like in the NHS. If they can write someone a prescription, there's a placebo effect there as well, that someone feels that they've got something. That makes sense, rather than saying, hey, why don't I refer you for talking therapy, when the talking therapy waiting list is like a year. Wow. So it makes sense to give them something at the time when they need it. And maybe for some people it will just help them and nip something in the bud and help them get back on track. But for many people, it's the beginning of a descent into more and more medication. We've had people, my last participant in the study was in her early 20s. She'd been on so many different medications. She'd put on so much weight from all the different medications. And it's only through being in the psilocybin study and like stopping all those medications and all the weight just falling off her, because she feels happy and she knows what she wants to do with it, and she's exercising and feeling good. She looks like a completely different person. Wow. So there is this descent into more and more medication. And so antidepressants, yeah, they definitely have a role for some people, and some people say that they've really saved their life. And if someone is feeling really desperate and taking some pills that are accessible, can stop them from feeling that desperate, they really can save lives. So I'm not saying that they're useless, but just that our use of them has become problematic. Okay. So, and yeah, what we see in the study now is, so the people in the antidepressant condition are, for some of them, the antidepressants give them lots of terrible side effects. They come off, or they feel incredibly depressed still and they just don't work at all. Some of them, they make them feel worse. Some of them, they do work, but when they work in a way that people say, yeah, I suppose I do feel a bit better, but, nothing's really changed in their life. And they don't really know if they want to keep going, because maybe it's like had some negative side effects too, and they don't feel that positive about the treatment. But in the psilocybin condition, it's a completely different paradigm. And it's one that I feel so strongly about, because for me, it's opened my eyes to it's not just about psychedelics, it's not just about psilocybin or any of the others. It's about a new way of approaching our suffering. And rather than numbing and taking a tablet, it's about going towards the suffering. And that's what often happens in a psilocybin experience. So the preparation we do the day before, There's a long screening process, but when someone's been accepted, we do a preparation day the day before. And that's really all about building trust and preparing somebody for something incredibly courageous, because they have to be so willing to sit with things. Well, you know from your experiences, they can be the hardest things you've ever done in your life. They can be, you can feel so lonely and so scared and petrified, all your normal frames of reference are gone. It's so hard to explain what it's like for someone that hasn't done it, but essentially it can be like a kind of battle. It's like a hero's journey for sure, but the dark parts of it can feel very confusing. So, and
again, no frame of reference. So you've never been there before. Whereas the other times in your life when you've experienced maybe something so painful, you could, run away from the social situation. You could have a drink. You could watch a movie. You could work out. You could cry. You could take a hot shower. In this situation, you can't. It's right there, and you have to be with it. And if you never have a frame of reference, it's shocking. And that's why people talk about sometimes their first their bad trip, or I was here because they just never expected to deal with this and didn't know how to deal with it.
Yeah, because there's you have to just, there's nothing you can do to stop it. And if you try and stop it, it makes it much, much worse.
Right.
So resisting it is the real stuff of difficulty.
Okay. And so you're briefing the person on this the day before.
Yes.
And you're telling them the same kind of things you're telling me now?
Well, so what we do is we talk a lot about the idea of going in and through the experience, and little ways they can, if it does get challenging, how they can accept that challenge and know that challenging experiences can lead to great transformation and amazing benefits afterwards and loads of insight. So that we really encourage people to trust that what's coming up is what they need to see, and trust this idea of an inner healing mechanism, an inner homeostatic principle. I was thinking actually as I was watching your film Reconnect last night, the other word, as well as reconnect, the other word that feels to me really important is rebalance. Because there's something about, we get out of balance with our lives in some way, and that the psychedelic experience can rebalance you, and that there is this kind of homeostatic principle at play. So if there's a blockage or something you haven't been looking at, it'll just take you there. And so that can be tough, but we really encourage, the key fact, the one key factor for the preparation is know that if you're going there and it's really hard, that's in you and you need to go there, and that's how it gets better. So it's gratitude for the opportunity rather than wanting to run away.
That's a really good way to frame it. And then the movie, Dennis says, ayahuasca doesn't always give you what you want, but it gives you what you need. And back to that homeostasis, it is showing you this because it knows you need to process this. You could spend 20 years trying to process it, or we could do it right now. And so
exactly.
It's great if you can frame people and then they can try to remember that in that situation, to think, okay, this is good, breathe. I remember one of my very early guests on the show, his name was Simon Powell. He had a book called The Psilocybin Experience or something. And he said, be with it. That's what he would say. Be with it. Just be with it and breathe and be with it. And don't fight it. And just try to be with that pain, that sadness, that elation, that joy, that whatever, and breathe and be there with it. And there was something I always go back to. In normal life too.
Yes.
And that's what I think you're talking about, this protocol. It's not just for the psychedelic experience.
Absolutely. It is that idea of, so in our model, what we do in the preparation session is we use this analogy of diving, going for a dive. And this informs the visualization exercise we do with people to prepare them. And it talks them through 6 stages. And these 6 stages are essentially the 6 stages of psychological flexibility. So there are 6 processes that, when you take them together, make up this thing called psychological flexibility. And we've ordered them, and so that they describe what a psychedelic journey is like. And we take people through those 6 stages to help them strengthen those abilities, and also so that they're prepared for what it might be like. And the key part of that is going towards the difficulty. And then our protocol is kind of around building those 6 processes of psychological flexibility.
Okay, can you talk us through the 6? Okay, so psychological flexibility.
Psychological flexibility.
Never heard that term before.
Yeah, and I think what's really amazing is that there's the team at Johns Hopkins just found that it's psychological flexibility that is mediating the reduction in depression with people after psychedelic use. So that is the key mechanism in this new paper that's just come out. Wow. So they did a really big survey study of lots of people. We need to do a kind of causal study before and after, but they looked at this big survey data and they found that actually with people undergoing psychedelic experiences, when their depression scores are coming down, the key mediator of that is psychological flexibility, so that's going up. So I think people will be talking a lot more about psychological flexibility in future. So essentially, psychological flexibility, this is a term that's been developed by the, have you heard of acceptance and commitment therapy?
No.
So it's a type of therapy based around contextual behavioral science. It's very interesting. It's kind of based on Buddhism loosely. Okay. And it's a developing mode of therapy which aims to help people recover from whatever they're going through via strengthening psychological flexibility rather than focusing on that particular thing. So rather than focusing on the depression per se or anxiety per se, it's more about building somebody's resources towards psychological flexibility. Psychological flexibility overall is about somebody being able to respond to moment by moment experience with their full self and respond to it in a way that enables them to act in line with their values. So it's like, who am I really? And being able to be yourself with whatever comes up and respond to life. It's basically responding to life flexibly and maintaining your sense of who you are.
Okay.
So it's not shutting off pain, but it's when pain happens, it's responding to it in a way that enables you to find the best path through so that you can do what you need to do.
Okay, which takes some amount of being able to observe yourself in that situation too. So you don't react with the anger, the pain, the whatever. You're able to see yourself in it and then say, how do I respond and be the fullest me? And something I'll be happy with later.
Yeah, exactly.
Okay.
But what's interesting about it is that rather than a cognitive process, a lot of it is happening on an embodied level.
Okay.
So I'll talk through the 6 processes. So I'll talk it through in the way we talk about it in the study, in the psychedelic, like the psychedelic dive. So the first layer is diffusion. And so for that process, if you imagine a sea, and if you imagine waves, a wavy sea, and that's life. Life with all of the stimulation and all the challenges and all the things we have to do, the busyness, and the waves hit. And so often we feel that we're just like swimming against the tide of the waves, and we're caught in that. And what we do in order to get through that life is we have this internal guidance system, the cognitive ego systems, protective safety system, which tells us, do this, you didn't do that right, do that better, why are you such an idiot, God, blah, blah, blah. All of that stuff that we all have, essentially. I've never met anyone that doesn't have any of it. Well, maybe some very experienced meditators and Buddhist monks, but people that haven't worked with it have got it. It's like the monkey mind. And so diffusing is bringing some awareness to, oh my God, my mind has gone into that bringing awareness, like you say, it's the awareness of it, and choosing to defuse from it. So rather than being your thoughts, rather than being lost in that wave of, I'm shit, I'm rubbish, I'm never going to be better, why do I always get everything wrong, nobody likes me, I need to do that, oh, I forgot this. Rather than being caught in that, it's stepping out, looking at that, and choosing to dive beneath the surface of those waves and dive into the body and the senses. So that's step 1, diffusion.
Okay.
So we ask people to imagine that they've been on a boat and that boats drop them in the middle of the sea and that they go down and they're in those waves. And this is like at the beginning of the psychedelic session, they decide to take those capsules. They choose to take those capsules, it's their choice. And when they take them, they're diving down below that surface of the mind, because psychedelics essentially dissolve those ego structures. They dissolve the default mode network for a while. So that chatter just disappears. So most of the time, it can happen different ways for different people, but essentially it's deactivating that ego, mind, and you dive down into the body. So the second process, so one is diffuse, diving down from those waves of mental chatter. The second process is present moment focus and being in your senses. So this one is sense. And that is about bringing awareness to your body, your breath, how your heart feels, how your stomach feels. So to do that one, we ask people to this is all in the preparation day, this visualization exercise. So we say, imagine that you're diving down through the water And as you dive down, imagine that you're diving down from your fingers to your toes, you do a body scan. So as you dive down through that water, you bring your awareness to your tips of your fingers and all the way down through your arms and your head and your heart, and you bring your awareness down through your whole body. You do it a couple of times, and then imagine they're diving down, and that helps people tune into their body and really helps with this process of disengaging from that mental chatter and going into their felt sense. Because this is where we carry our emotions. This is where we carry how we really are feeling. When we're so stuck in our heads, we don't know how we're feeling because we're just in our defense. And we're not in our real tenderness and our real physical, fleshy reality of how it feels to be us.
To continue watching the rest of the episode for free, visit our website londonreal.tv or click the link in the description below.